Imagine you've just seen your GP and been told that you have Irritable Bowel Syndrome or IBS. You get home and you search the internet and suddenly you're wondering, could this be something more serious? Could it be bowel cancer? These are the most common concerns I hear in a clinic. In this video, I will explain what IBS really is, why it is not dangerous, and what are the symptoms that you need to know that you need to go to see a doctor. Hello, I'm Dr. Ali Al-Attabi. I'm a gastroenterology doctor in the UK, and on this channel I explain digestive health in a way that's practical, evidence-based and easy to understand. What is IBS? So let's start with understanding what IBS actually is. IBS is one of the most common disorders that affect the digestive system, but it is also the most misunderstood. The most important thing to know is IBS is not a disease that damages your bowel. Instead, it is what we call a disorder of gut-brain interaction. Think of your gut and brain as two people constantly talking over the phone. Normally, that conversation happens in the background without you noticing it. In IBS, the phone line is still working. However, the messages become louder. So normal digestion, normal bowel movement can be interpreted in different symptoms, such as bloating, pain, or you're feeling the need to open your bowel. Is IBS dangerous? The short answer is no. IBS does not increase your risk of bowel cancer. It does not lead to inflammatory bowel disease, and it does not shorten your life. However, that doesn't mean IBS is stress or the symptoms are not real. IBS can have major impact on daily life, work, social life, travel, sleep and confidence. In fact, studies have shown that the impact on quality of life can be similar to some chronic digestive disease. One thing I tell my patients in the clinic that pain and bloating they experience are real. They are absolutely real. The goal isn't to dismiss the symptoms, but the goal is to understand why it is happening, how we can manage it. Why don't most people need a colonoscopy? Most people assume that all patients with IBS need a colonoscopy. The truth actually, this is not the case. Most UK guidelines encourage doctors to make a positive diagnosis of IBS based on symptoms, simple blood test, and the absence of red flag symptoms or warning signs. This is an important thing to discuss here, because with requesting unnecessary investigation increases the anxiety level among the patients because of the waiting time and the thinking about the procedure ahead, and taking into consideration the risk related to the procedure itself and the time it takes from the patient and from the staff. So when should you seek medical advice? Although IBS isn't dangerous, there are certain symptoms that you shouldn't ignore, and these are unintentional weight loss, if you notice any blood with the stool, or if your blood test shows a new iron deficiency anemia. Also, if there is a persistent change in the bowel habits, especially in elderly patients, and if there is any abdominal or rectal lump. These symptoms don't necessarily mean it's a cancer, but they do mean that you should be assessed promptly by a medical professional. What actually helps? There is a misconception that there is one treatment that can be a perfect treatment for IBS. there isn't. The best approach is usually a combination of understanding your condition, identifying the triggers, choosing the treatment that works best for your condition. Most studies suggest certain measures that many people with IBS found useful. On top of the list is doing regular exercises, which help with the circulation of the blood and also with the bowel movement, and it helps with the mental health, and overall it improves the IBS. Other appropriate measure is to use soluble fibers, and also avoiding long lasting fibers. The other thing I noticed that most patients with IBS try to restrict some certain type of food, and actually the advice is to avoid unnecessary restriction of food such as gluten, or using like a gluten-free diet, unless there is another indication for it. Now, we use medications as needed, and there are various, and for different indication. The next step after the failing of medication is gut directed psychological therapies for some people with persistent symptoms. Important thing to highlight here, it is not a psychiatric disease, rather, as I mentioned earlier, it is a disorder of gut-brain interaction, and some psychiatric therapies could be very helpful. Understanding the condition itself is actually one of the most important treatments. When people understand why their disease is happening, they become less anxious, and that can make a real difference. What I tell my patients. So when I diagnose a patient with IBS, this is what I say. IBS is real. Your symptoms are real. However, IBS does not damage your bowel and does not lead to bowel cancer. The aim isn't to live with your symptoms. It is to understand them and identifying your own trigger that lead to your symptoms, and working with your healthcare team to find strategies that help you live well. If you found this video useful, I would appreciate it if you subscribe to the channel. I will be answering more of common questions I hear from patients every day, helping you understand your gut with a clear evidence-based explanation. Thank you very much for watching, and I will see you in the next episode.